The goal of every athlete when they participate in a sport is to, first and foremost, have fun, and the second is to be able to participate in that sport for a long period of time without an injury. So being proactive about your workout plan certainly helps keep you out on the field safely for a longer period of time. The most common cause of our sports-related injuries are overuse injuries. So excessive amounts of workouts over short periods of time, or dramatically changing your workout program in a very short period of time. The treatments for our overuse injuries, believe it or not, most of the time is rest, and that's the most difficult thing for most athletes to hear, but that even short period of rest, and then seeking attention from a medical provider to see whether it's just rest or is it a home stretching program, maybe it's physical therapy or additional treatment that's necessary, but getting out in front of it really helps you to make the diagnosis and to assure you're on the appropriate treatment pathway. There are many sports injuries that occur that do not necessarily require an x-ray. And a lot of those are our soft tissue injuries, hamstring soreness, a calf strain. Those may not necessarily require an x-ray, but if they linger, it certainly is worth having it evaluated by a healthcare professional. As to whether you know you have a concussion or not can be a very difficult question. And most athletes, if there is any time where you've experienced a trauma or experienced an injury where you just don't feel right, whether you have a headache or nausea, you feel a little spacey, the best thing to do is to remove yourself from competition or remove yourself from that activity and then seek attention from a medical provider to help you make that diagnosis safely. If there's an acute injury where you have difficulty bearing weight or pain that's lasted more than a day or two, if there's swelling or black and blue around an area, that's certainly a reason to seek medical attention to assure you're out in front of the diagnosis. Our University Hospital sports medicine team works in a very collaborative nature. And while orthopedic sports medicine is at the core of it, our primary care sports medicine physicians, our athletic trainers, physical therapists, nutritional consultants, and concussion experts all work together to assure streamlined care of our athletes transitioning from the doctor's office and injury back out onto the field.